Welcome. This is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at Practice Management Nuggets, webinars for your healthcare practice. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. I am your host, the Practice Management Mentor with Information Managers. And this week, our guest is Ronaye Kooperberg, instructor in the Health Information Programs at SAIT Medical Office Assistant and Unit Clerk Programs. This will be a powerful, information-filled 30 minutes, and we're going to get through lots of great content in a very short period of time. So please make sure that you're prepared to take notes and turn off your distractions. I'd like to make sure that everybody can hear us and see the slides. So take this opportunity to check in with us on the chat button and let us know that everything is working for you on your end. We're looking forward to getting through to your questions as best as we can. If you have questions for Ronaye that we're not able to get to today, leave us a question in the chat box with your email address, and we'll try to get back to you just as quickly as we can. We will save our online questions until the end of the presentation today and get through the content in about 30 minutes. We can continue to answer some of the questions after that point during our After the Show. So now I'd like to introduce you to Ronaye. Ronaye Kooperberg is an instructor in the Health Information Programs at SAIT, focusing on the Medical Office Assistant and Unit Clerk program. She started her career as a medical transcriptionist, but quickly moved into a medical office assistant role. After 12 years in a variety of offices and departments, she moved into a teaching position. She holds a Bachelor of Arts and Bachelor of Education in Elementary Education from the University of Alberta and a Master's of Education Technology from UBC. Welcome, Ronaye.
Well, thank you, Jean. It's a pleasure being here. Thanks for asking me to join you.
I am so thrilled that you're here. There's so many questions that I want to ask you and hear your expert advice and messages. But first, let's take a look at the elephant in the room. Many healthcare providers don't know what an MOA can do, and they don't know how they could fit into a healthcare team in their practice. Ronaye, what is your number one tip for that every healthcare professional, practice manager, or healthcare team member needs to know about medical office assistants? What is your number one tip?
My number one tip is that most MOAs, medical office assistants, are completely underutilized in the healthcare setting. So we all know that MOAs are really good at their day-to-day job, but there's a way for them to contribute more to their environment, and they want to contribute more to their environment. So I really feel like bringing that MOA in and having that conversation about what can be strengthened within the clinic, what can be improved, is it communication with the patient, is it looking at how can we guide a future direction for our clinic or by extracting data from our EMR. Those are the ways that, that's the number one tip I have. Utilize this MOA. They are a great resource within your clinic and they really want to help you.
I think that's so true, and I'm so excited to get into this conversation with you. So you're right. Many of the MOAs aren't doing the full scope of their abilities and their practice and what they can offer, partly because the people that have hired them and that they're working with don't know what all the things that an MOA can do.
Absolutely. I would 100% agree with you. We do try to train our students to be a little more proactive on that end about getting out there and saying, this is what I can do, and I would like to help you with it. So hopefully we can start to see a change in the industry soon.
Okay. So give us a breakdown. What types of things can an MOA do? And perhaps what are the things that an MOA can do that you don't often see them doing in their practices?
Well, besides the day-to-day things like taking care of the physician's schedule, making sure their clinic runs well, being the face of the clinic, we really are trying to push our students into to extracting the data from the EMR, from the electronic medical record. We want our students, in order to get the quality data out, they have to understand how to put the data into the EMR. And I think this is where the medical office assistant can really start to use some of their skills there. putting in consistent data, putting in, if somebody comes in with diabetes, putting it in correctly every single time in every spot. So when we go to extract the data and to find out what kind of demographics and information or problems our patients are coming in with, then we have the chance to utilize changes in the clinic. And so that's where I can really start to see some of those MOAs going above and beyond.
Okay. So we've got MOAs who spend part of their time in many locations working at a desk, working at a computer, and accessing the EMR. What other types of skills would you expect from an MOA?
Just general skills. I think soft skills cannot be underestimated in a quality MOA. Being able to connect well with your patients, being able to be professional, remain calm under pressure, learning how to deal with that difficult patient, the patient who's in pain. I think these are definitely skills that are absolutely 100% needed by the medical office assistant.
Okay. So in the training program that you're working with, what types of clinical skills would an MOA have as well? What do you teach them in the programs?
In the clinical skills, we teach them obviously how to take vitals, well baby checks. Let me see. It's been a while since I taught that class. Definitely urine dipsticks, height and weight, BMI, moving into waist circumference because BMI is kind of falling by the wayside. So those are the general skills. One of the questions that we have is what is too far? And I think that's one of the problems with, one of the challenges with being an MOA is where is that line? Where does my scope of practice start and stop?
And that's an interesting point. What is the scope of practice and where does it stop? So how would you respond to that?
That's a tough one. I think it really is case by case. Obviously, we have a scope of practice that mostly is administrative with some clinical skills. It has to stop before we give medication, of course. But I've seen some students who go out on Practicum and they are taught how to do like staple removals. Well, that's not necessarily something we teach, and it's something that even some physicians might not be 100% comfortable with. But some other physicians feel that there's definitely a skill that they could train their MOA in. So I think there is I think it really is on a case-by-case basis. And I do feel that some physicians, if they feel like they have a very capable MOA, they will allow them to take a history. They will allow them to enter that information into the EMR. And some physicians feel that's not the job of the MOA. That's the job of either the nurse or the physician to complete. So there really is some gray area in where the scope of practice starts and stops with the MOA.
And the communication between the physician and the MOA about what their expectations are becomes such a critical part. We want to make sure that the physicians and the care providers have confidence in the skills of the MOA. Mm-hmm. So one of the things that I do in the practices that I've worked with is that we've created a workflow checklist, which is a communication tool between the physician and the MOA. So Dr. X wants to make sure that their MOA does a height and weight for every patient who comes in and wants them to do a blood pressure for every patient over the age of 65, for example. And we've come up with just a simple checklist. It's just on an 8.5 by 11 piece of paper. We cut it into 3 columns, and then it becomes a communication tool. So if this is a patient of Dr. X, this is what Dr. X expects for this type of patient. They're over the age of 55, or they're youth, or they're a pregnancy prenatal, and these are the things that the MOA is expected to do. So if the MOA is expected to do a blood pressure, for example, they would write the blood pressure on this temporary transitory sheet of paper for the patient, and then the physician sees that transitory sheet of paper for the patient when they see the patient, and they say that the MOA has checked off to say that they've done the height and the weight and the BP, and then the physician can verify the information, especially for the BP, and get some confidence to know that the MOA knows what they are doing, or if there's a skill that they're lacking or something that needs to be better, perhaps, then there's an opportunity for the physician and the MOA to have that discussion. And that becomes a really great, valuable tool to be able to kind of certify or validate for that skill set for the MOA in that practice that, you've met our expectations for providing services for this type of patient. That goes into the MOA's performance review, employee review, probationary review, perhaps, to say that they've demonstrated that they can do these types of skills.
Absolutely. That's a fantastic tool to use. Absolutely. I think it's important for the physician to have confidence in that MOA, because without that confidence, they'll never let that MOA grow.
Right. And the other part with that is that if you're working in a practice that has more than one physician, you've got more than one way of doing things.
100%, yes.
Each physician wants things done a little differently, and
Yep.
that's fine. But we need to make sure that we understand what those expectations are. Otherwise, the physician is never going to be happy with the staff that they've got in place, and the MOA is never going to feel confident to be able to provide the services and work to the scope of practice.
Absolutely. Absolutely.
Yeah.
That's a great tool. I would definitely, insist if I ever see that communication breakdown in a clinic, I will definitely, tell them, maybe this is a tool you can use. That's wonderful. Thank you for that great idea.
Yeah, and it works especially well when you've got a new practice that's just opening up, because you don't have any bad habits to break. And a lot of the physicians don't know what an MOA can do and, what they want them to do.
Mm-hmm.
So it really helps with that communication piece of the puzzle. So, Ronaye, what do you see as the difference between a skilled MOA and the receptionist in a private practice clinic?
Definitely the skilled MOA will be the one who is asking those questions or anticipating something happening before it actually happens. I think a receptionist is just there to make sure that the calls are getting answered and patients are being checked in, whereas the MOA is really taking it that other step, that more of the clinical portion of it. So whether they're doing a height and weight for physician X or for physician Y with a patient over 65, they're getting the requisitions ready to be filled out by the physician. They're just taking it that extra step, and they're really starting to assist the physician in the flow of patient care.
Okay. And I'm going to take a moment here just to let folks know that we've got a couple of resources for them during this Practice Management Nugget webinar. So we have a learning resources guide, so you can download that from your internet link here, and you can follow along with the conversation that we're having today and take your own notes about some of these ideas that might be of some value for you. Now, I've also provided a download for a template for a job description for a medical office administrator. Yes. And the template for the job description is a listing of all sorts of skills that an MOA might be doing in your practice. In that template, you'll need to pare that down a little bit. You don't want the person to be responsible for everything, but become really clear about what are the primary responsibilities for that medical office administrator or assistant in your practice. So you can use that template and customize it for your practice. It's downloaded off of a Dropbox file, so if you have problems accessing that download, let me know, and I can send that to you separately by email. But I wanted to make sure that we left it in a Microsoft Word document so that people can customize it for your particular practice. So there are a couple of resources there that are available. Ronaye, let's talk for a moment about how we actually get the MOA into our practice. How do they fit into that healthcare provider team?
Well, I think that the medical office assistant is probably in the most unique position within the clinic. They really can't be compared to anybody else because they see and oversee everything. They have a different view of the clinic than, say, a nurse or an LPN or a physician, where they see the start of the visit. They see sometimes they're in the room for the visit, depending on if they're helping with a pap smear or anything like chaperoning. and then they see the patient leave from their clinic as well. So they get to see everything. They see everybody's job. They see how everybody interacts. So I really think that the MOA, they fit in, the way they fit in, they have to make sure that everybody's job is running as smooth as possible. And then a positive interaction with the MOA will lead to a positive interaction with the LPN, the nurse, the physician, or any other staff member, healthcare staff members that are there as well. They're in a very unique role within the clinic.
So one of the things that we hear about those key people that we have in our practices is to hire slow. So we want to make sure that we've recruited the right individual and we've spent the time to make sure that it is the right individual and that we help them with that orientation process. So what types of things do you suggest that the practice consider about hiring an MOA? How do you find the right MOA for your practice?
I really think it comes down to asking the right questions during an interview. A lot of the MOA job is constantly being interrupted. So asking good questions about how is the person's ability or the applicant's ability to dealing with interruptions during the day? How do they prioritize for the day? Do they get, and observing them, do they get annoyed with small interruptions as they're trying to complete certain tasks? Also assessing applicants' ability to cope with a difficult patient or a difficult situation. Does the person attempt to troubleshoot, or do they hand off the responsibility to somebody else? Another thing is, are they looking to be an active partner in creating the best clinic they can for the patients, for the physicians, for the nursing staff? Or are they looking to be provided 100% of their tasks? We want somebody who is wanting to be there and who actively wants to make the place a better environment for everybody.
Okay. Now, one of the things that I tend to do when I'm hiring new staff coming into a clinic is that I might actually give them a practical skills test. Mm-hmm. What types of things would you suggest that an MOA should have as far as practical skills when they first come to your practice?
Practical skills, the ability to answer a phone, I think is a huge part of our job, and that's probably the scariest part of our job. We can interact face to face, but when that phone rings and you don't know who's on the other line, it is very scary for somebody who's new to a clinic. We don't know what hours we're open or what the fax number is. So these are all things that, practical skills, how can we find those things out if they weren't presented to us? Definitely the ability to be a critical thinker and have attention to detail is huge a skill for the MOA. So as for practical skills, maybe setting up a situation where you have to demonstrate those things, maybe the attention to detail and a situation where they have to answer a phone or deal with a difficult patient.
Okay. And when we've identified the right employee, we want to be able to provide the appropriate orientation for them in their practice. What are the key things that you think makes a difference for a successful orientation procedure for an MOA coming to your healthcare practice?
I think one of the most important things for the MOA for the orientation is ensuring that they have that they have been fully introduced to everybody. A lot of the times when we work in a facility, we'll think, oh, well, that's Dr. Y. He only is here every Monday morning, so there's no need to introduce that person. And then it becomes a little bit awkward after a while, or if you have a very busy clinic with lots of residents coming in or practicum students, it's very important for that MOA, because they are the face of the clinic, to let them know who everybody is and what their role is. It's very important for that person to understand the role of each individual, so that if they do have a question, they are going to the correct person, not wasting everybody else's time. For orientation, another thing is bringing them around the clinic, showing them around. It may seem a very simple thing to do, but it will alleviate a lot of problems in the future. And orientating them to the computer systems course and to the electronic medical record, whichever one is being used at that time.
Okay. So let's imagine now that we've been in practice for a while, and perhaps your MOA has been in the practice for a while. What do you think you might suggest to the MOA who's been in a practice that isn't getting the opportunity to do all those things that they would like to do? How would you coach that MOA to be able to talk with their supervisors to expand their scope of practice and provide some additional services?
It's a great question, and I think one that is not the most easy answer to give. I really think it depends on the person and how comfortable they are going up to their supervisor and saying, you know what, I really see this, or for instance, maybe lack of communication with our patients, communication when the patients are leaving the clinic. How can we best utilize or utilize me as the MOA to be that end for the visit? How can we, maybe we can get them in for their next appointment, or maybe book their next appointment, or follow up with their test if they need any help with booking an CT scan or something like that. So it's about being proactive enough and wanting to better themselves, I think, going up to their supervisor and just having that open communication and trying to expand their scope of practice that way. But I don't think this is going to be easy for everybody. I think there's some people that it's definitely going to be easier for, and maybe those more shy or quiet people, it would be definitely a challenge for them. But it's about getting out of your comfort zone, and they've got to make the change for themselves.
Okay, so we've got an MOA that's new. We want to make sure that they understand their roles and responsibilities and who they're going to work with, so that we can share that communication piece. And for an MOA that's been in the practice for a while and perhaps wants to expand their skills a little bit, having that conversation about where they could get started. And perhaps there's a trouble area in the clinic that they think that they can make some recommendations to say, I noticed that we've got a problem with patients leaving the clinic without rebooking their next appointment. I think I can help you with that. May I be allowed to approach the patient and do a checkout process with them to make sure that they've got all their information, they've got their prescriptions, and they know when to rebook an appointment? Is that something that I can help you with?
Absolutely,
for example.
100%. That's
right.
fantastic, yeah.
Okay.
Yeah.
And I come from a documentation point of view, so if you can suggest some, if the MOA could then suggest some procedures, or putting something in writing, coming up with a brochure, something to get started with, shows some initiative and helps to be able to demonstrate what those changes might look like.
Absolutely. That's one of the questions we always ask our preceptors when our students are on practicum. Are they showing initiative? Are they going up to you and saying, what can I do? Or can I help with this? Or I see something that can be fixed here. So important for the MOA to show that initiative and to be able to expand their role and say, look, this is what I can do for you.
Right. Okay. The next part is a little bit of that tricky question about, what is an appropriate salary for an MOA? And one of the things that I've done here is I've taken a look at the Alberta Wage and Salary Survey that's publicly available on the Alberta government website. And this is their salary survey from 2015, so it's pretty current. Yeah. And this is for medical administrative assistants. So the salary range varies a great deal. What is your experience about the salary range for MOAs in Alberta in private practice?
Well, my experience is nothing really formal. It's mostly going around to my students and asking them when they're on practicum, what is the wage? They'll speak to everybody there. And I've seen it as low as $12 an hour and for starting, and I've seen it as high as $21 an hour for starting. So there is a huge discrepancy in the wage, in the starting wage. I don't really know. I don't really have an answer as to why it's this way. I think those places that have really good MOAs, they need to keep them, or they want to keep them, so they pay them a higher wage so that they won't they constantly are not looking for another job.
Right. And you want to be able to keep your good employees in your
Absolutely.
organization, because the cost of retraining and rehiring and going through that process is time and money and frustration. So you definitely want to be able to encourage those good MOAs to be able to stay with you.
Yes, absolutely. I've had a couple conversations with physicians who, one in particular who will remain nameless, and he says, I can never hold on to anybody. And I said to him, I said, you might want to pay them a little bit more. I said it very
Absolutely.
nicely, but yeah, I mean, if you have somebody good, it costs a lot of money to put an ad out, to not have somebody for a while, to retrain somebody. Yeah, absolutely. It's just, pay them a little bit more and they'll stay there. And I think the good MOA who shows initiative, has great attention to detail, and has great communication with the patients that come in, they're priceless. So I think they make or break a clinic.
Absolutely. What are the ways that an MOA can improve their skills or expand their skills or stay current? What are some suggestions that you would have, Ronaye, about how an MOA can continue to grow in place?
I think a couple things that I've suggested to students in the past is to look for continuing education opportunities. Maybe doing a CPR course, expanding their medical terminology, maybe even going into some pathophysiology and understanding the body and the body processes better. And also learning how to be a critical thinker, which I think is a huge part of this job, but not necessarily one that is the most easiest taught subject. So I think that's definitely one area that they can start to expand the role, and to do a lot of self-reflection, to think, okay, this is how I'm doing my job now. I want to be better. What can I do to get there? And a lot of self-reflection and asking the people around them, the mentors that they have with them, what can I do to better myself? And getting that feedback from the people that watch them every day.
Right. And there are a lot of things that are available at no cost or low cost from the Alberta Medical Association, for example. So physicians have the opportunity to be able to send their staff to training. There's online training programs available from information managers, for example, and certainly a wide variety of other resources. One of the things, as we're talking about salaries, that employers need to recognize that everybody in their organization needs that opportunity for continuing education. So it might be a vendor coming into your organization to provide a lunch and learn, or somebody that, for example, sterilization procedures. You're purchasing some additional equipment. Include your MOAs in that training opportunity to learn about that new equipment, and to be able to compensate your employees for those opportunities. We all want to be recognized for our achievements, and MOAs are certainly no different. They may not be regulated within the Health Professions Act, but they're certainly a very important part, and they should be part of that appreciation that comes both in salary and monetary, but also in other ways, and how we provide opportunities for our staff to grow in place and to be able to support them to be able to do that.
Absolutely. Absolutely. And sometimes overlooking them makes them, not including them in those types of opportunities, really demoralizes them. And, I guess I'm not really part of the healthcare team. And they really are the backbone of the team, and including them, it really does help solidify that relationship between all of the healthcare workers within that facility.
Right. Ronaye, what do you find is the skills shortages in healthcare in Alberta for MOAs, in particular in private practices? What types of requests are you getting from the community about hiring MOAs? Are they dime a dozen, or are they difficult to recruit?
I think from what I've seen, I think the really good ones, the ones that have all of those skills that we've talked about so far, they're not a dime a dozen. They're very sought after, and for the ones that for the lesser skilled MOA, I think the things that they need to brush up on are their soft skills, their ability to communicate with patients and their ability to put people at ease and their professionalism and their ability to remain under calm under pressure. I think those are probably the skills that are missing in those MOAs that might not be as sought after as some of the other ones.
I see, too, that there are a lot of some regional differences. So if you've got a new practice that's opening up in one of the new communities in the city, for example, it might be really difficult to recruit an MOA because it's difficult for an MOA to get public transportation to the outskirts of the city. If they're downtown, they have challenges coming because they can't find parking. So there seems to be a lot of regional differences, even within one side of the city to the other side, about how easily you can recruit an MOA to your practice.
Yeah, especially where I live in Calgary with our urban sprawl problem, I find that a lot of the newer communities are phoning us for practicum placements because they just have a really difficult time finding employees that are willing to commute that far out to the edges of the city where, you know, maybe the community is so new, they don't have many people that are qualified who live in that community to work there.
Well, that sounds like a great opportunity. Tell us about practicum placement opportunities with SAIT.
Absolutely. So our practicums, we have two practicums, one occurring in January and one occurring in May. And they are 4 weeks in total. And our students go out to you. They're fully trained. They have our SAIT stamp of approval. And we place them in the clinic. They basically have a booklet of competencies that they have to be able to perform in front of a preceptor who is looking after them. And then you have a SAIT instructor come 1 to 3 times per practicum, and we just check up on our student and we answer any questions. And if there is any issues, we mediate those issues. If there's maybe there's some training that has to be done, we can sit down with our students and refresh some skills that they need refreshing on. For the most part, it's very successful with between both of our practicum placements and our students, and they find it just solidifies the theory that they learned in the classroom, and it really does give them the confidence to move forward with looking for a job.
Okay. Does SAIT provide a job board? So if I'm a clinic looking to recruit an MOA, can I post a job posting with SAIT?
We do have a job board. I did look at it a little while ago, and I'm not sure if I'm not sure what the status of it currently is, but I think my email is posted, and they can certainly, I have a lot of places just emailing me directly saying, I'm looking for a new grad I would like to hire. Could you send this out to your students? And I certainly provide that service for my students.
Oh, wonderful. Okay. So on your Learning Resources Guide, you have Ronaye's email, and we have it on our slides here as well. So if you're looking to recruit, that's an opportunity as well, whether or not it's Ronaye at SAIT or some of the other facilities in other locations. That's an opportunity to be able to recruit MOAs to your practice as well. Now, I want to mention very quickly about the Hiring Employees Resource Package. So this is a resource that I've produced for information managers, and it's a membership that you can sign up for this resources package, and you will have access to the templates for MOAs, receptionists, clinic managers. You'll get job postings, opportunity or suggestions for interviewing skills, how to rank your employees or your interview candidates, how to come up with a decision, a sample template of an acceptance letter, some points about orientation and keeping your employees, and even performance appraisals for those employees that you currently have. So as a special offer for the people that are attending for our webinar today with Ronaye, we've offered you a coupon for 50% off of the cost of the Hiring Employees Resource Package. So the Hiring Employees Resource Package regularly sells for $9.97, and for a limited time, when you use your coupon code, it is now available for $4.98. So you get downloadable Microsoft templates for all of these things. And in addition, you get some great interviews with some of our other guest experts about how to interview, how to recruit the employees to your staff, and how do you do orientation. So this is a great learning opportunity for practices that are looking to recruit. And for the cost of $4.98, for the cost of a fancy coffee, you will have all of your templates to be able to recruit and hire your next MOA or other people to your healthcare practice. So that's another resource that's available for the participants with our webinar today. Ronaye, we're getting close to wrapping up here. Do you have anything else that you'd like to add, things that you want our audience to know about hiring MOAs?
I think I would just like to let you know that your MOAs are extremely skilled, and if you ever have any questions about what they can do, or just go and ask them. They're more than happy to tell you about their skills or how they can contribute more to your organization.
Okay. Thank you for that, Ronaye. On our slide here, if the audience wants to contact you for follow-up information or about how to recruit an MOA or about learning how to be a practicum preceptor for your program at SAIT, you can contact Ronaye at the email address, Ronaye Kooperberg at SAIT.ca, and the phone number there. So you're on a summer break, but all of those emails can add up so that you can access them when you're back after the break.
Yes, absolutely. I am checking my email, just maybe on a couple times a week.
Okay, all right. So Ronaye, we have talked about many things, and I'm so glad that you shared this information with us. We've talked about how we can better utilize our MOA in the practice, the challenges of facing for MOAs in healthcare right now. We've talked about how to have MOAs involved in the orientation in your healthcare provider team, and how the MOA can contribute to your successful healthcare practice. We've also talked about how the MOA can learn on their job and some tips to be able to interview and recruit and retain those MOAs, and how current MOAs can grow in place and become a more valuable member to your team. I'd also like to be able to put the thought in the mind for our employers that are on the line to have a conversation now with the MOA and in your practice and say, so how are things going? What do you see that we could do that might be different? Take the opportunity to have a conversation with your MOA and see how their role is fitting in the practice. Things change over time, and perhaps it's a good time for you to be able to review with your MOA about how they can continue to provide some services to the healthcare practice, and that you can encourage that communication between the MOA and the healthcare team.
Wonderful.
Ronaye, thank you for helping us to address the elephant in the room. I want to remind our audience that you can contact us for additional information, or if you have any suggestions for upcoming guests or upcoming topics for Practice Management Nuggets. You can reach me by email at jean@informationmanagers.ca. You can connect with me on LinkedIn. Just search for Jean Eaton and send me a connection request and let me know how you found us. You can follow our Twitter feed at InfomanLTD. And I'd be tickled pink if you liked us on Facebook. This is Jean Eaton, your practice management mentor with Information Managers. I'm delighted that you've joined us today. And I ask you to return and stay tuned. I want to be able to help you to find and manage those elephants in the room.
Thank you so much, Jean. It was a pleasure.
Thank you, Ronaye, and I'm looking forward to talking with you again. Wonderful. Stay tuned.